asking if there are any conflicts of interest. Do any of the committee members have conflicts of interest that they want to announce at the outset of our meeting? If not, we'll go to the mission statement. Ms. Smith, would you mind reading, please, the NGH mission statement and vision?
Happy to. The NGH mission statement is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. The NGH vision is to be a leader in exceptional community health care, one neighbor at a time.
Thank you, Ms. Smith. We have a quorum, and so we'll proceed with our business. First order is whether there are any public comments. We offer an opportunity for the public to make any comments at the start of our board and committee meetings. Ms. Lester, do we have any public comments?
No, sir.
Great. Thank you. So a couple of announcements before we get to the new business. There's food available for those who are in the room, and I see many of my colleagues are enjoying it. I'm going to go up in a minute and get some food. I have this affinity, I was thinking this morning, because this food is brought to us by, coordinated by Ms. Lester, who really appreciate it, from the hospital's food service. As a lawyer, I'm very sensitive to lawyer jokes, and I realize that hospital food, like lawyers, seems to be the brunt of a lot of jokes. Yeah, I mean, there's actual an affinity. So, but if you will see, this food is delicious. So,
it was made by one of the good lawyers.
It was no lawyers. This is hospital food. That's what I'm saying as a lawyer. So, and healthy. It's fantastic. So look, no lawyer jokes and no hospital food jokes, because in all seriousness, I really appreciate the hospital food service providing lunch for us, and it is delicious, and thank them very much for providing us lunch during our meeting. The first item on our agenda is the consideration of the interim CEO. And this has been the discussion at board meetings as the part of our committee's charge from our board chair is for us to consider this and make a recommendation to the board. If you all recall, when Dr. Webb left, we as a board appointed Dr. Elders as the acting manager because we needed someone in the chief executive role. We had discussed the possibility of having an interim CEO that might be someone other than the acting manager. Thus far, based on what the board has said in its meetings and Dr. Elder's role, I think we have coalesced on the idea that Dr. Elders is doing a fantastic job as acting manager, and though it is not this committee's decision, the board is looking for a recommendation, as Dr. Martin has asked, for us to confirm that this committee does not intend to conduct an interim CEO search, but envisions Dr. Elders continuing to serve that role while we go through the full CEO search process. I will open it up for any discussion or comments about that and see if there's some common understanding among us as to our recommendation to the board on that respect.
I mean, I would be very comfortable with Veronica Elders to continue in her role and essentially function as an interim CEO. She knows the hospital. She's already made a number of what I would consider very good changes in the system. She has been open and met with all of us, and I can't imagine improving on what she has done so far.
I'd just like to add that I think that she is a bridge builder and a very quick bridge builder. And I think that speaks volumes in terms of her level of energy, but passion for it, and being a practicing clinical nurse provider. She certainly knows the patient care side and those kinds of things, but I think it's just been phenomenal in just a short time.
I would agree with my fellow board members. I've seen personally her commitment to the hospital and been on multiple virtual and in-person meetings with her. I have had the opportunity to see her evolve and work with the deputy finance group in Metro and create a pathway for answering all the audit issues that we had, both with Crossland and then also through the Metro audit. Work with Dr. Blackledge and organize cash flow, and then ultimately go through our supplemental ask, as well as, again, meeting with all the board members. So I would echo those comments and recommend to our full board that she be allowed to keep that position. One thing I do think this committee should address, and it doesn't have to be today, but I would love for us to discuss an appropriate compensation level for both the interim CEO and the interim CFO, as those positions, they're being asked to do a lot more in those positions, and I'd like the compensation to appropriately reflect those work hours and commitment. So thank you.
Just to be clear, would be my desire that we would recommend to the board that Dr. Elders actually be named the interim CEO and not just continue with the title that she has now.
Agreed.
I agree as well.
We're unanimous in those sentiments. I agree that Dr. Elders has been doing a remarkable job in the brief time that we've asked her to serve as acting manager, and that it would be appropriate recommendation to the board from this committee that she be appointed the acting CEO. And as Ms. Smith said, I don't know that we are prepared at this meeting to discuss specifics of compensation, but also the will of the committee being that because she's taken on additional responsibilities over and above what her current responsibilities have been up to this point, that the board should consider change into her compensation. And I think either at our next meeting or at our next full board meeting, hopefully we'll have more information so that we can make a determination as to what that appropriate compensation is, but understand.
I don't know if there's another meeting of this committee already scheduled, but the board meeting will be, I think, in 13 days. So we may not meet again before the board meeting. I'll work with Metro Legal to see how we deal with the salaries.
Okay.
There might be an opportunity as well to obtain some data for those interim CEO positions and look at some kind of ranges and median as well. I'm sure that information is out there. I know it is for other like on-call doctors, et cetera. So I'm sure we can find that and work with our HR department to make sure that that is an appropriate amount.
That makes sense to me. And I think that if the last item on our agenda will be to come up with a cadence of a meeting schedule for this group. So I don't know, I'm sort of previewing that I think it may be appropriate for us to schedule meetings every other week so that we can move this process forward expeditiously. We may not need that every time. We'll do that at the end of our meeting. So Dr. Martin, we may or may not meet before the next full board meeting. So absolutely the consensus of the committee is to recommend to the board that Dr. Elders serve as interim CEO. I think at this point we would not be able to, because we don't have the information, market study or comparison, like what other, what the compensation for that role is with respect to certain benchmarks. But so we don't have that now, but absolutely can recommend in general that we need to determine as a board what the market compensation is for an interim CEO role so that we can be fair to Dr. Elders with her new responsibilities.
But does this have to be, does the compensation have to come through this subcommittee?
I don't know that it does. I mean, we don't have legal counsel here to tell us like whether as I understand, Dr. Martin, the board chair, has created this ad hoc committee to, on behalf of the board, run the CEO search process. As a part of that is a consideration of the interim CEO. Whether we must recommend a compensation, I would think is an administrative operational issue that we can work out and present either to this board for recommendation, this committee for recommendation, or directly to the full board. Could be done either way. Dr. Martin, do you have a thought on that?
Well, just thinking about it, the board has never considered compensations of any of our leadership team or employees except for the CEO. So this will fall in between somewhere. And I don't know, Diana, if you have access to the information that we're talking about, you know, market rate for interim CEOs.
I can get it through probably Permar, and they're known for compensation. They did the last compensation survey for us. Also, in the past, it was just a draft to be able to say, here's what we would like to do to give. And it was with the finance and with the board chair just to do that. And if you wanted to do it that way, it's up to you how you would like to do it from a transparency standpoint, if you want to be more transparent or not. But the compensation, we should be able to get that for you.
Great. If you'll get that to me, and then I'll work with Metro Legal to make sure that we do it right. Thank you.
Great. Thank you all. Janet, do you have
Do you want to make a motion for recommendation of Dr. Elders?
Yes, I entertain a motion that on that respect, if someone wants to offer one.
So moved.
Second.
There's been a motion. It's been properly seconded. Is there any discussion or questions on the motion? The motion being to recommend to this committee recommend to the board that Dr. Elders be appointed interim CEO and that the board consider the compensation that's due would be due to her in that position. All those in favor of the motion say aye. Aye. Any opposed? Motion carries. Great, thank you. Okay, so the next item on our new business is CEO job description, and this actually folds into the third. I'd like to essentially defer consideration of the job description. Dr. Martin provided me to give to the committee the current job description that, or the most recent one that we have for the CEO position. I think that a prior item of business is for us to consider the need to hire a search firm, an outside search firm that will assist us and help us run this process, conduct a thorough nationwide search, which would be appropriate for this position. And part of the role of that search firm would be to help us develop a job description, which would have a prior process of gathering information from the board and the hospital staff and from the community and other stakeholders as to what that position is, meaning what is it that are the important qualities we need in our next CEO. So if I may we'll talk about a search firm selection process. Let me offer a little bit of background, and then we'll have a presentation in a moment in our meeting. I initially asked Diana and Stanley Woodall, who is with us, who is the procurement professional within the hospital. The hospital has a procurement function. Asked what existing vendors we may have through an RFP public procurement process for executive search firms, and was told that AMN, which is a nationwide specialty, well-recognized executive search firm in healthcare, was a current vendor. The hospital conducted an RFP in 2014, and AMN was selected, or a predecessor to AMN was selected to be our vendor in that respect. So we have an existing relationship. We don't have to go through any kind of procurement process. If we choose to engage AMN as our vendor in a moment, I'll introduce them because people are here to talk to us about that. I also, so that the committee knows, contacted Metro Government in general. Metro Government has a search firm, executive search firm, likewise selected through an RFP process, which is different from AMN. I was put in touch with a contact person from that firm who suggested that we meet next week. I let her know that AMN was presenting to our committee today. We were interested in moving expeditiously if that affected their desire to meet sooner, and she said, no, I'd like to meet with you next week. And so be that as may, I'll provide that as information. They are not, to my understanding, a specialty healthcare firm. I do understand that they have some healthcare capability, but so that the committee is aware, there is another vendor that is sort of on the shelf that's available to us if we want to hear from them or consider them. The advantage, again, being that we don't need to go through a procurement process in order to engage them. But those are the discussions I've had so far. Dr. Martin?
What is the name of that firm?
Name of that firm is Insight Global. If anybody wants to do some research. Insight. Yes, INSIGHT. Okay, so that's where things stand. So now we're going to get to AMN. I spoke with River Meisinger, who was the contact person for the hospital with AMN search firm. He and I have had several very productive conversations this week when I mentioned what our committee's task was, and that one of our initial decisions was to determine whether we were to use a search firm and which search firm that would be. River said that he would assemble a team very quickly and wanted to present to us as soon as he could get in front of us, which is today. And so I really very much appreciate River assembling a team, coming here to talk to us about their proposal and plans. I told River is a very active, inquisitive group, and we would expect some discussion, but I do very much appreciate AMN coming in on relatively short notice and giving us what is their proposal or plan for how they would conduct a CEO search process. And I will at this point turn it over to River for that presentation.
Awesome. Yeah. Excellent. Thank you all for having us. I think there are four of us in the room, as David said. When he called, what I can start with is we have a history with Nashville General Hospital. So to us, it matters, and that's one of the reasons we're here so quickly. As we go back with you all, I believe probably 11 years that I can think of in the last 7. I've had the honor to work with Diana and many others. So the mission and the work that you do in the community is important and impactful. So there are four of us. I want to have Monique introduce as well. I've been with AMN just about 8 years. It will be actually in May. My background is coming up through our search side of the work. And so that's actually where I know you all, as I have done recruitment with you in the past. But for me, right, the reason why we're doing the work that we do on a day-to-day basis is you have leaders, right? You have clinicians and you have nurses here. And they need access, right, to the right leadership and the right impact, right? So when we get that right, that means that we're partnering with you to be a steward of the work and finding the best leader for the community. So we're honored to have the opportunity. I will be here from a point of contact and client to help in a liaison. I'll turn it over to Monique and introduce, and Mick and Hisham, as they introduced today, will really be the team that would be representing and out front in the communication and day-to-day. So I will turn it over to Monique, and I'm going to move seats here.
Good afternoon, everybody. And again, I want to echo our thanks and gratitude for having us today. My name is Monique Alaman. I hail from Boston, Massachusetts, and I am a former healthcare executive. So the first hospital that I worked at 25 years ago plus was a safety net hospital in Massachusetts. So very familiar with the unique dynamics and it's a heart-driven mission. I've stayed in healthcare for this length of time and have been fortunate to work with Mick and River for the last 7 years through many changes as we're seeing in healthcare. So there is no greater decision than bringing in a new leader in times of transition. My father was studied at Yale in public health, and just to watch how healthcare has changed and the important responsibility you as board members have to be mindful of the quality of care and the financial health of the organization. So I just have such confidence in this team, having seen our work and the impact that we have with hospitals across the country. That's why we are the #1 executive search firm. And as a recovering marketing executive too in healthcare, I would be remiss not to share that, because hospitals, you're proud of your leapfrog and quality scores, and we're proud that we earn the trust of our clients over and over again. So it was a pleasure to come down from Boston, and really looking forward to getting to know all of you and supporting this important process. Thank you.
Board committee members, nice to meet you all. My name is Hisham Siddiqui. I am a consultant with AMN. I've been with the organization for about 4 years now. Prior experience is additional executive search work with Whit Kiefer, a global executive search firm. So most or all of my work has been focused on healthcare, just various organizations, hospitals, health systems, academic medical centers, and so forth, with C-suite as well as other positions, VPs and directors. So having joined AMN a few years ago, I've worked heavily with Mick over the last few years, lots of success, especially with CEO searches. And, my role as a consultant is actually the front end of the recruiting process. So most or all candidates that folks see go through me before they go to Mick, and then so forth to the clients. So I do look forward to potentially working with you all. We appreciate the opportunity to come here and discuss this role with you.
Thank you, Hisham. Good afternoon, everybody, and again, appreciate you and the invite to come in and speak with you today. Mick Rule, one of the principal partners for executive search for what I will introduce as B.E. Smith and AMN Healthcare, one in the same company. B.E. Smith was acquired by AMN several years back, but you'll probably hear both those names through the process. I think that was the name that you were referring to previously as well. I've been doing this for more than 20 years. My father was a physician. My daughter's a nurse, and I get to be the guy that does search in healthcare, right? So they're doing the important work, or had done the important work. But I've worked on positions anywhere from the director level of a clinical department to the CEO of multi-billion-dollar health systems. There's not much that I haven't seen or been part of when it comes to recruitment in healthcare. Look forward to the discussion today, and really want it to be an open dialogue. I want to share information about our capabilities and what we do, but most importantly, I want to answer your questions and make sure that you've heard from us as far as our capabilities to help you through this process. The most important decision a board is going to make is who you hire as a CEO. There's no bigger weight than that on this group, so certainly envy the task at hand for you. We have a very structured, regimented process to go through when it comes to CEO search. We have the luxury of being able to script that out, so we can bring you through that journey together. But we've got a pretty good plan of how to start and how to finish and get there. And look forward to discussing that with you today.
Great, thank you very much. I guess we could either. Well, we'll open it up to questions, and I don't know if that's what you want to just have some dialogue about it. I guess so. An initial question that I would have, I'm sure the committee will have others, is can you give us the both timeline in terms of what the process is, but also what are the milestones? Like what are the building blocks from if the time that we chose to engage you as a firm? What are the major components of this search, and what is an anticipated timeline?
All right, there's a lot to cover. so from inception, from the signing of the agreement, right? You've engaged us to do the search. We get started. The first thing we do is we build out a prospectus. We incorporate your position description. If you want our help on that, we do offer that as well. We incorporate that into what we call a prospectus. And the prospectus is a a single document that's a complete overview to candidates about the position, the organization, and the community. So it's a one-stop document where they can get the information they need to be able to assess and get an overview of the organization and the opportunity as your CEO. We don't use that as a marketing document. We may use components of that, but we use that once we have candidates engaged in process, right? So we've identified they've expressed interest. We want to start sharing information. But the first thing we do is build that out, and we work with you to do that. So we do most of the work, and then we ask you for fine-tuning edits of, does this represent what you want to say as an organization to potential candidates as we move forward in process. So from the signing of that, the launch, we want to do, the first thing we do is intake, and we're going to meet with as many key stakeholders as we can, and this is a critical part of the process. We will start with you as a search committee, take your guidance, look for your input as to what you are looking for in your next leader. We would spend the better part of I'm thinking of the better part of 2 days on site here at the hospital, meeting with key stakeholders, meaning physicians, executive team members. I share this with clients. If you think about a candidate coming in on site to interview, those are the type of stakeholders that we want to meet with and get their input. Taking that a step further as a public organization, you may have key stakeholders that you would want to include even in the front end just to participate and have a voice, be heard. So we offer some thoughts on that, and we offer our time to be able to do that as well. Serving the community the way you do, there may be people even outside of the organization that you might suggest we might want to talk to. So we offer all of that on the front end. We want to do that intake. We want to get as much information to understand the role and the organization as best we can. You'll hear me say this as we go through process together. The most important thing for me and my team is fit. I make some assumptions on experience. I make some assumptions on education and experience and qualifications and capabilities. Really what separates it through the interview process is the fit, identifying who's the best fit for this organization for what you're looking for now. I tend to look at those through 5-year windows of the task at hand, the challenges. So in that intake, when we do that, I'm not just asking what you're looking for. I'm also going to ask you, what are the challenges somebody's going to face coming into this role? What is reality? And we want to make sure that we are identifying potential candidates that are up to that challenge, right? That can make a difference and help the organization move forward. That's critical for me and the team. So that transparency on the front end, the honesty and integrity of the search process and gathering that information is critically important. You'll hear me later talk about when we bring candidates forward, I offer you the same in return when presenting candidates. I want you to know who they are, what they're capable of. I want to tell you what I think you should be interviewing them for. Any shortcomings, any place they need to complement their skills within the team, right? So if we do all those things honestly and transparently, you and the candidate at the end of this process have made a really well-informed decision, right? So that intake on the front end becomes critically important to that. So after intake, prospectus is built, we go to market. And so we're going to spend a lot of time in market. I'm going to break this down by weeks and days for you too. I think that that's, David, I think I heard you ask for that, right? So I'll make sure to break that down. The first 20 days is a lot of this intake, a build of the prospectus and getting the information out. Marketing starts. We go to market 3 different ways. We are going to promote the position nationally, online, with a lot of exposure through a marketing effort. We want people to know that the opportunity is open and available. I don't care where the right candidate comes from as long as we get to the right candidates, right? So that's kind of the easy ways, right? A lot of posting of the position to get a lot of exposure. The second and most important, and this is where most of our placements come from, is utilizing our own contacts, our own network. 85% of our placements come from this. We're going to send out communication, usually in the form of an email, to a large amount of individuals that are either capable of this role and responsibilities or know somebody that is. And I'll give examples. We'll send it out to more than 5,000 people. And I'm never surprised when it comes back. Ari told me about this opportunity. It sounds like it'd be a great fit. I'd like to hear more about it, right? So it's not necessarily the person we're targeting as much as that network works for us, right? So a lot of reach through those avenues. And then the last method is Hisham and I and the rest of the team, we will identify a short list of people that we want to contact directly. So we're going to pick up the phone and we're going to call and we're going to start talking to people and use that network with the intention of recruiting candidates, but also secondary to that is networking. That's going on. And mind you, that's going to continue until you hire somebody. All of that effort in recruiting. There's no cutoff date to when applicants can apply for this role. That's the first 20 days to 35 days where we're doing the initial interviews. So Hisham will be doing an initial interview probably up till 45 days will be the bulk of his interviews. At 45 days, he's pushing candidates forward to me for his interview is a qualifying interview, making sure that people meet the minimum qualifications, they're capable of being successful in this role. They push forward to me. My interview becomes more about fit. Are they a fit with the organization, the team, the community, the expectations for this board? So we're starting to look through that lens with a much more intense conversation around that and a more critical eye for that fit versus are they qualified? I assume when they come to me, they are, right? And that's a thorough vetting process just to even get to that point. So 45 to 60 days, that's the bulk of my interviews. And again, these will continue, but the bulk is done in that time frame. 60 to 75 days, we're compiling candidate information for presentation. Between 75 and 90 days, we would be in a position to bring candidates forward to the search committee. We would present somewhere between 7 and 10 candidates that we would bring forward with our recommendation for interview. We would ask you as a search committee to interview 5 or 6 of those candidates. The first round of interviews is the bulk of time that I'm going to ask from you as the search committee. So those first round interviews, and again, I can change this process any way you like. It's your search. This is what we've seen that has worked well over the years. That first round interview, we're going to schedule a 2-hour interview for each candidate, expecting it to be 90 minutes. That's a 2-hour commitment for each candidate. I'm going to ask you to interview 5 or 6. That's a 10 to 12-hour commitment on your part to conduct those interviews. That's probably the most important part of the interview process. You're going to spend more time interviewing, scrutinizing, and challenging the candidates during those first round interviews than will take place even after that. So that's the bulk of the ask from you that I'm going to ask from a time commitment. Of those 5 to 6 interviews, ask you to identify 3 finalists to come on site and interview for a full day and a half, 2 days with the entire organization. That whole process will take about 120 to 140 days, depending on the time frame of the interviews after presentation and after first round interviews. That's the unknown and less control of timing that we have is once we get into those interviews and the timing of scheduling those interviews. That's a walk through the process and the timeline. During this time, as we're working with you as our search committee, I love that you were talking about meeting on every other week. We update on a biweekly basis. So every 2 weeks, we're going to get together with you as our search committee, and we're going to start talking about the work that we're doing, what we're seeing in the market. And so by the time we're presenting candidates, there's probably not going to be a lot of surprises. So there's going to be more head nodding of that's what we've expected to see, right? So from candidates' experience, candidate background, where they're coming from, by the time we present. And the difference is during those update calls, we're talking about candidates on a high level of experience and who they are and what they bring to the table. When we present candidates, that's when we're sharing resumes, full summaries on each of the candidates and what our observations are through the interview process. The other thing that I like to offer to clients, and it might be different, and maybe it's part of mine and my team's style, is when we present candidates, I don't go through a lot of their background. I don't rehash what you see on the resume. I'm going to tell you what our experience is working with them, what their leadership style is, what their soft skills are. I want you to, what we call bringing life to the paper. I'm trying to get you a sense for what you can expect from that person should you choose to interview them. So a lot of effort to go in, and that's where that intake on the front end of what we heard and what's important, then we can start matching that up and lining that up as we are talking to you about candidates. I'll go back and repeat this. That whole process, even after I've presented candidates, our recruitment process continues. If there's a candidate that we still feel you need to see, we won't be shy about bringing them forward, right? So the whole effort is to make sure you get the right hire for all the right reasons and the right fit. I look at 5-year windows for placement. I look at the first 5 years are on us, the next 5 years after that are on you, right? So we love that longevity for placement. And we can speak to some retention rates if that matters. I can bring up some numbers related to that. But that's the timeline, the process. It's thorough, it's scripted. We will try to stay one step ahead of you the entire way. So if we know we're going to present candidates on X date, we're going to line that up, get that scheduled. In anticipation of you identifying 5 to 6 candidates for interview, we will already schedule first round interview dates beyond that. So candidates will know when that's going to take place. You will know what your time commitment is. Once you've identified 5, we're comfortable moving forward. First round interview dates are scheduled. Now we'll start looking at finalist dates of when they come on. And again, the luxury of a CEO search is because we know the response that we're going to get. It's a little bit more regimented where we can script those out, identify those dates in advance to make this really easy for you and the organization. Any questions on timeline and process?
We're talking about a 6-month process.
By the time they start, so
No, a 6-month, but 175 days is kind of what your last.
140 probably for us to run process. We're probably at about 140 by the time we make an offer that's accepted. Okay. And then you get into their notice period. So if you've got somebody that's gainfully employed, their notice period could be 30, 60, or 90 days. 90's less likely, 30's most likely. We're seeing some 60-day notice periods too. So yes, it could be. When I'm talking about process and timeline, what we control up to the acceptance of an offer, probably 140 days. Other questions on timeline or process?
I think you know this, but we have a unique situation in that Open Meetings Act exists in Tennessee. So 2 of us can't really be in the same room deliberating in any way unless it's a public meeting. So that's may present different models for interviewing. So we need to consider that.
Yeah, and we can work with that. The one thing that will concern me as we go through process is candidate confidentiality, right? And so we want to safeguard against that and understand that when you have finalists identified, when you have 3 finalists identified, that becomes public, right? There's no hiding that. With the amount of people that those candidates are going to meet with, that should be something that everybody's aware of. That should be more of a public understanding. Up until that point, I try to, and this allows us to be effective in recruiting candidates, we try to respect the confidentiality of those candidates all the way through first round interviews. And so we can, again, on those updates, when we're updating, we will talk at a high level about candidates that we're speaking with. We may provide an overview of background and experience. Even when we share candidate information with you at the time of presentation, we could talk about how we do that appropriately and safeguarding for our candidates, but also adhering to your public meetings acts.
On that issue, have you ever presented, so at the stage where you're presenting 7 to 10 candidates to narrow to the 5 or 6 sort of preliminary interviews, do you ever anonymize the information? I mean, I'm thinking of just what are the creative ways that to respect the privacy and the confidentiality of people who might be looking for a job and don't want their current employer to know they're looking for a job, seems reasonable. But for us to be able to, as a body, every time we meet, as Dr. Martin said, it must be public. I'm just thinking about very specific things, but like how exactly do we go about that to reconcile those two interests?
And we have done that before, again, working with other public entities. We've had this experience and process. We can redact information regarding candidates as far as names and even organizations they've worked at, right? Again, safeguarding to it. We could speak to it and provide you as much information as we can as a search team. Again, we want to make sure you're able to evaluate the candidates fully as well, right? So we don't want to sacrifice that either. Candidates that are interested in raising their hand for this will know the public aspect of this. They'll understand some of the inherent risks of that, but we will try to safeguard to that as best we can. And it could be redacting some information on resumes. It may be the way that we share candidate information with you. We want to make sure you're well informed, at the same time safeguarding against that confidentiality for candidates. So we've got ways and methods that we can offer to do that. We have experience with it. I think that might be the most important thing to state, right? And it's not always one solution. It's what's the best solution that works for you and this organization with respect to the candidates as well.
I think also collaborating with our other Metro partners and entities to find out how they have done it in the past. We already have a mailbox set up, an email box that for our board. So when it hits that email box, it immediately goes to everybody's personal emails. So we receive information at the same time. And thus far, just so you know, the information, if an individual, for instance, comes to us, said, hey, I'm interested in the position, we will then forward it to the email box where it gets distributed. So I think that at least the initial part of that, Janet was kind enough to set up, but I do think it makes sense to reach out to other Metro entities and find out how they've done it as well.
Does that separate you from organizational requirements when you do that, as far as the information being shared through that inbox?
You can share information, we just can't deliberate. So let's say we went to a cocktail party. We can be at a cocktail party, we just can't talk about the agenda items for which we would be voting, is my understanding. And I can't say, hey, Dr. Nettles, so what do you think about this? I think you should vote my way, right? You can't do that. But, you know, from a standpoint of, I think disseminating information is not a non-issue. I think it's really about, like, how do we talk about and collaborate, both to protect the identity of some of these individuals that would be interested, but also knowing that whatever we're saying in these formats would be a public record and viewable right now as an example on live YouTube channel. So I think that's the main thing to know. But again, this isn't a creation of the wheel. Many people, many CEOs have been hired throughout Metro government here. And I think talking with Derek, our legal entity, as well as their HR department in Metro, would be very helpful in this discussion as we proceed.
Great.
And that probably answers a part of my question, because I was thinking in terms of just logistics, the development of the prospectus and that kind of thing. What preparation do we need to do, or is there something already put together in terms of working with you to even put this, one-stop document together and then keeping within a timeline that is reasonable, but also, meets our needs? And how is that done? And so that would be helpful to me. But again, it probably is laid out somewhere, and I just want to kind of understand.
Yeah, from the time of launch of the search, if you agree to work with us, we're talking just days to put that together for you and be in a position to review that. And again, it's a little bit of a beacon through the search that we always go back to say, did we state this correctly? but it does not prevent us from getting into the market and start having initial discussions with candidates. I usually like to have that document finalized by the time I interview candidates, and that's usually 45 days into the search, right? So that gives a really nice time window to be able to work with that and make sure it represents the organization and the position well.
The prospectus follows the stakeholder meetings, correct?
It does, because there's portions of that intake that we want to make sure we include in there, right? So it's not just your position description, it's a narrative of here's what this looks like, right? Here's what the opportunity really is.
I wrote a couple of things, and I don't expect us to go through all of them today. I guess the first question would be how would we, maybe as a committee or individually, if we have questions that we would like answers to, how would we best go about obtaining those answers? So maybe that is, disseminating those questions to David, and then he can be the pool and then get that information back out to us. So just a couple ideas. I'd be interested specifically about your company, other companies that you guys have worked with, either here locally or even regionally. Other positions, have you had expertise in, or other positions here that you've hired for, and how have those turned out, like a track record of what you guys have done? Lesson learned from our last hire. So what did you do last time? How would you do differently? And then evolution of that. I would like to learn about trends of the position, the CEO position, and how that has evolved as medicine has been somewhat decentralized. I'd like to learn about salaries and trends of the salaries, where you've seen that go. Do most of your candidates come from, ultimately end up as local or national candidates? The length of tenure expected, and what that looks like, and I think you addressed a little bit of that, but a little bit more on that. I'd like to have somebody who was very knowledgeable about safety net hospitals, but also clinics, and understanding how those work in conjunction, and better understanding the downstream revenue, and making sure that they understand what our footprint looks like. And then also how your CEO objectives and evaluations are tied into the actual job description, for lack of a better term, that's built. And or love to hear your feedback about how we have set ours up, and to make sure that we are not setting out an objective by which people are being evaluated for annually, as our committee does, that doesn't tie with the initial reason they're hired. So those are just a couple things quickly I jotted down and want to be able to follow up with. Again, not expecting all that right now, but just figuring out the best way as we have questions to get that information to you and then have that received back. Thank you.
I'd like to add one more to that list.
Wow, great.
Because I thought,
I hope you're I know. I hope you're writing it down.
Yes.
Because I'd like to hear to this now, to the extent you have answers.
The involvement in the collaborative efforts with academic medicine, a partnership with academic medicine.
I'm going to start on some of this to address it. We've got information that we've brought that we can share as far as an overview of timeline process, proposal type information.
You have written materials?
We do.
You want to circulate those now to the extent we can refer to it? Okay, that'd be good.
So I'm going to defer to River and team as far as other work at Nashville General. I'm going to address some of these questions you had just at a high level. So CEO trends. I'm sure as you've gone into this, and maybe not, so I won't make assumptions, CEO turnover is exceptionally high right now. There were two articles recently that were printed. One regarding CEO turnover this year of 2025, 244% increase month over month of CEO turnover this year so far in 2025. We have a white paper that we have been sharing where a survey was made of sitting CEOs, hospital CEOs. 46% of sitting hospital CEOs expect to make a move from their current position in the next 18 months. Incredible numbers, right? So So I think about that. I get excited about the work that we're doing, right? So that's a lot of conversations and a lot of people that we get to connect with and talk to regarding opportunities. There's the macro issues of healthcare that are drawing healthcare leaders outside of their institution into more of the national aspects of what is going on with healthcare. When we talk about funding and some of the other things, I think you're seeing a difference in connection with leaders to their own organization. I'll tell you two things that I'm witnessing and everybody that I'm talking to and the clients I'm working with. Financial pressures over the last 2 years have been greater than they have been in years past. So we've learned over those 2 years how to adjust and adapt to that. We're getting better at it. We're starting to see some recovery from that, and the financial outlook in 2025 being better than it was in 23 and 24. The other, the CEO turnover that we've seen, but because of this draw outside of the organization, I'm seeing a lot, and a lot of the CEO movement may be attributed to this, the lack of connection down into the organization with staff, employees, and physicians. It's almost, and I hate to use this word, neglected, but it's maybe assumed that those things are fine and everything's going well while our attention's drawn outside of the hospital and the health system for all the macro issues that we're having to deal with. Those are two common trends regardless of where I go right now. And then it takes intention on leadership part to make sure those things don't get missed. Salary, we could talk about that. We've got tools, resources that we can use that we could do salary surveys. We've got in-house resources that can provide for that. What I like to do is not just rely on salary surveys, but I'm going to give you real life market intel as well, like what we're seeing, right? So you can add that to your information as you look at and evaluate and make decisions for your own organization. Tenure, I did talk a little bit about that, is I look at placements in 5-year windows. For any new leader coming in, even if they had an agenda when they walked in the door, it's probably going to take about 3 years to complete that. Even if you know what changes you have to make, it's going to take 3 years to implement any kind of changes in culture, finance, quality, whatever those initiatives are. That's assuming that's day one. So it's going to probably take 6 months to a year just to learn the organization, become aware of what those challenges are. So I always look at those first 5 years. I gave this example to a client before. We had made a placement of a CEO, and just shy of 5 years, he had taken another opportunity for advancement for himself, higher paying role, and was leaving. We were asked to come back in and do the CEO search again. Meeting with the search committee was, we want the next CEO to be here for 20 years. That's it, right? That's what they were looking at. And I had to kind of redirect them to say, Bob was here for almost 5 years. It was a financial turnaround when he started. And now I'm hearing that physician relations is a concern. So the emphasis for this next hire is mostly on physician engagement, physician relations. Would Bob be a candidate today for your CEO search? Well, no. Be careful what you wish for, right? So sometimes too long is too long. But I look at that 5-year window, and honestly, so here's the caveat to that story. We placed a gentleman, and he just retired after 18 years of being there. So they asked for 20, we got him 18, and that's just one of those great, fun stories to tell, right? But it worked out for the right reasons. It wasn't scripted that way. It just worked out that way. But that's why I look at kind of 5-year windows. There's challenges and tasks at hand that require a leadership style, and that's what we go out and look for and try to match up for you. And so that tenure becomes, if it works out beyond that, that's fantastic, right? It maybe is more about cultural, environmental fit, and we're trying to gauge that as much as we can too. We've done a lot of work with other essential hospitals and clinics. So the work that we do is broad. We could speak to that and give you plenty of examples. I think what we would default to and what we have in the information we've shared is what we felt was relevant search experience is probably going to be all hospital-based CEO placements, but I can also include outpatient or clinic work in there as an addendum to that information if you need it. CEO objectives, this is done, between intake, between working with you as a search committee and then what you do as a full board, identifying CEO objectives. One of the things that we ask and one of the questions we ask is, what do you expect this person to do in the first 6 to 12 months? And so you start to establish some of the early objectives coming in. That doesn't mean it's a complete list. It doesn't mean that it won't change, but we want to start identifying what somebody has to come in and first they do. Usually it's the first 90 days listen, just know the organization, get to know everybody. And then the involvements with the academics. So we do a lot of work with academic organizations. In fact, we have an entire search team that's dedicated towards academic search. We blur the lines, we work together, we incorporate some of those aspects into what we do and vice versa. And depending on the search, depending on the client, it may make a difference on who participates in the delivery. But what I would tell you is that if there's an academic component, Hisham is responsible for being kind of the front end of the market, identifying candidates, doing a lot of the recruiting. If there's an academic component, we wouldn't be shy about bringing in somebody that functions in the same role as Hisham that maybe is in the academic space if that's a candidate that we wanted to go after. So they might have better network, they might have better relationships in that arena that we'd want to take advantage of. So you wouldn't miss on that if we had the opportunity to work with you. And then I'm going to turn it over to River to talk about some of the work that we've done at Nashville General, which, by the way, I think is, if it's not included in here, we'll make sure that it is.
Yes. First off, I love the questions you compiled just immediately. That's impressive. I'm just quickly going through. I think one thing, and Mick did a really good job of clarifying, right? One thing that's different, and I heard you say early, David, and you probably heard in each of our introductions, we are a healthcare executive search firm, right? So maybe broadly coming back to the points he made around the work we do in academics, both independent community medical centers, right, clinics, right, health systems. If you heard the introductions of each of the individuals here today, what we don't do is industry executive search, right? So that isn't our specialty. I don't know what the vice president of a bank does, and so we just don't do that, right? So the work we do is specifically aligned to healthcare, and even to Monique's call out, right, around being number one. For those that look at the publications, right, or the work that goes on outside, I think Modern Healthcare has given us the nomination of number one in executive search in healthcare. I want to say 11 out of the last 12 years. I could be off a year there. So just a little bit of credibility in what that means. And then at the same time, we have provided compensation data to Diana and team in the past. If you look back in your public records, actually, I presented that data to you. So I believe in transparency. When David called, I shared with him, right, wrong, or good or bad. We actually placed Dr. Webb here. I did not. So, but when you engage with an executive search firm, our colleague, I believe her name was Laura, was the individual who actually worked with you to do the recruitment of Dr. Webb. So speaking of retention, I believe he has been here for just about 11 years. So that gives a little bit of fact finding. And then we can get the holistic number. We've done both interim leadership recruitments with you. We've done permanent executive recruitments with you. And we've also done physician recruitments with you, right? So when you think of B.E. Smith and AMN Healthcare, we go beyond executive recruitment and interim leadership. So there are many other service lines involved, but I just want to highlight one because we did help you with the chief marketing officer search. It would have been probably just about 4 years ago, if my math is correct. Her name was Sherry Gibbs. I believe Sherry was here for just about 2 years and 5 months, Diana, if my math is accurate today. And I think you asked a really good question. What did we learn from that? Part of the reason we're in the room with you today is because of the mission you have, right? So we do a lot of executive recruitment, as Mick shared, in a national setting in all different environments. And what I will say is Nashville is a very attractive city, right? So when we went through the recruitment of Sherry, I want to say we had in excess of 500 applicants. And I'm not joking, right? And we're talking Fortune 500, global healthcare, right? But when it came down to selection of why you chose Sherry, it was the mission, it was the community, it was the factors of, at the time, right, food for pharmacy, right? You had a lot of initiatives going on in how are we going to grow and also become, I think at the time, attractive is the wrong word, but continue to share our mission with the community. And we need somebody that can help represent that. So not to say that is the reason why you're looking for a CEO now, as Mick shared, that's the process we go through. But the importance, right, of why we are here, why we are in person, right, is there were a lot of qualified candidates that could have done that job 5 times over, right? But the individual leading, a $20 billion healthcare system might not be the right healthcare executive for you. So I think the process and understanding of what that looks like is the most important pieces, right? And then I think at the same time, what could we have done better? What did we learn from that? I'm not certain, and Diana would have to highlight for us the challenges around Sherry's departure, but what I can say is it's always important to have commitment to moving, right? So whenever you do a national search, I think part of your question was, is it local? Is it regional? Is it national, right? That's why we search in all capacities to make sure we find you the best candidate. But at the end of the day, if we're going to relocate and bring somebody nationally, we want the ties, right? Why Nashville? Why to be a part of the community? Why to engage in the community, right? Mick will probably talk to you later on about site visits and what that looks like, right? If there's spouses and children, how do those become involved too, right? Because when we do see things go wrong, and at times we have, right? I joke because we hear, physicians, right? You get the physician coming in and wife or husband maybe looking for a house, right? And they're sitting in the back of the car with their arms crossed, probably not a good sign, right? Because at the end of the day, you need somebody that's not just going to be visible and engaged here at Nashville General Hospital. I suspect you want somebody that's going to be a community member and a pillar of the community. And so if I could say there's something that we always want to do well or do better, it's making sure that we highlight and differentiate there.
I think the other thing I would say, we've already seen some candidates for, I guess they were candidates for interim CEO, and they all blend together because they all describe themselves with such superlatives. It's amazing. But what we also need, we don't necessarily need somebody who has, been a CEO of a large hospital system. We need somebody that would have the passion for what we do here and to take us forward for where we need to be. And some of that may not come out just in, their job history, but also in getting to know them personally.
For sure. That's where I go back to fit, right? And all the things that we learn and how we evaluate. And I'll just give you some ideas of how we get to that. How do we really learn who the individual is versus the 8x10 color glossy of the work that they've done, right? So a couple ways we do that. First of all, as an independent third party, I might be talking to them about more than one opportunity and more than yours. And this is a great way to really hone in on whether they want your position or if they want a position, right? So I do soft takeaways. I know we're talking about Nashville General, but what about this other opportunity over here? Well, that's interesting, but let me tell you why, right? Let them start leading me towards it versus I'm just looking for the next opportunity and hope to get this one, right? So we do things like that as far as soft takeaways to really understand the candidate's motivation, what their desires are, and what that is. So like I said, it's matching up that fit that both you and the candidate have made a very well-informed decision on whether this is the right fit for everybody. I want Hisham to talk a little bit about the national, regional, local focus of the search. So just how he approaches the market.
Sure. Dr. Miller, just in terms of your question, what you had just asked with Mick, So regarding fit, I'm not just moving random people. There's many people who can do a job on paper, right? But I'm also focusing on fit. So it's a two-step process. If I find them as a fit and Mick doesn't, then they're not moving past him. But if we both find them as a fit, they are moving through. And part of fit, I know Mick said, he can ask a couple of questions. We ask early on, are you active in the market? If you are, what are you looking for next? If so, why are you active in the market? And some of these questions also help us understand if they are truly looking for, as Mick said, your opportunity or just another opportunity in general. Now, in terms of sourcing candidates, we do go national, and we hit the market hard early on. However, there's also precision in geography. Someone more local to Tennessee is more likely to relocate to Nashville versus someone from California coming all the way here. That's not to say it doesn't happen. We're seeing a lot of immigration from California to Tennessee, obviously. But in general, you're going to find more success with candidates locally than nationally. Now, in the end, like I said, we are going nationally, but we're focusing on job boards for marketing locally and nationally. We're focusing on our network locally and nationally. And you're going to see us going in outward motion. So we start from Tennessee. You're going to see us go outward. You're going to see us hit the East Coast, the Midwest, and then the West Coast. And this is kind of just how we funnel candidates. Now, I am the front-end recruiter here, so you're going to see candidates early on in the process. Many, River said one of their searches had over 500 applicants. You're going to see something similar happen where I'm going through all these candidates. And again, we're focusing on geography and fit. These are the two biggest things. Is relocation truly feasible? If it is the compensation in line with what you all are looking for? So we do have a national emphasis, but, the focus in terms of locality and how we source candidates and who's truly a fit. Culturally, you're East Coast, Tennessee, you're a lot more unique than what you're going to find in Tennessee and Wisconsin, Minnesota. So although we are national, we do want to emphasize we're looking at more, fits both culturally, organizationally. We also bring a diverse slate of candidates. And diversity isn't just gender, it's not just ethnicity, it's the organization type that they're coming from. It's the amount of experience they bring. We might bring you someone early on in their career who shows a lot more fire in their belly to get the job done for you all, and that may be what you need at the moment. We might find you someone who's been there and done that, at a similar size organization, similar type organization. That might be what you prefer. There's a comfort in someone who's been there and done that, but there's a lot of excitement to someone who's early on in their career and bringing you some fire. And so we're looking at all sorts of candidates. We are looking nationwide, but again, there are little parameters, and especially after our stakeholder calls with you all, based off what you described in terms of who you're looking for, what they've done, and what they can do. All these little notes that we take on your discussion will be what helps us decide who nationally and locally we can target and truly consider as prospects or candidates for your search.
Dr. Miller, I might just add one more thing from a credibility standpoint. Healthcare is a small world, right? So when you get to this level of leadership in healthcare, it's degrees of separation. So right to your point of reading a resume, you want to know the individual. We also want to know credibility, right? So there are referencing that's going to go on, right? And we're going to ask individuals, right? Likely we'll probably know anybody that's going to be in front of you anyways, but from a credibility standpoint, we want to know from others, right, where they've been successful, where they may have had challenges, right? And those would be transparent throughout the process, because at the end of the day, you just don't have the room to make a wrong decision, right? We started with that, right? This is the most key and crucial decision for you.
Yeah, that's a good point. I never want to put somebody in front of you that's going to be an embarrassment to me or you, right? So we do a lot of vetting in the background, and we're going to provide a lot of information, again, about who a person is and maybe not just their experience. Two more things I wanted to cover related to that. We have an assessment tool that we use, a behavioral assessment that we would utilize, and your 3 finalists would all be assessed. And I love the delivery we have a third party that executes that and provides the feedback. When we provide that feedback, he does a side-by-side comparison of the 3 finalists. So this is what this person's assessment looks like, this is this person, but then the comparison of this is how this person's motivated and how this one is motivated differently. This is what they care about. This is not necessarily a concern of theirs. Great insight to, again, eliminate as much risk as we can in your hiring process, right? So we want to bring as much information as we can. And then in the information we've shared, AMN does a phenomenal job. This team does a phenomenal job of diversity, equity, and inclusion. So you'll see that we weave that through the search process. Hisham alluded to it, that you're going to see a diverse slate of candidates. You're also going to see diversity in that candidate panel, right? So that will be an emphasis of ours. At the end of the day, we want to make sure we're bringing the right candidates forward regardless, but there will be an emphasis and make sure that there is diversity to be considered throughout the process.
I was noticing in terms of the process, I mean, I think one, the type of person and culture and kind of organizationally Nashville was when you did this originally is very different from where I believe we are at this point, and very different even from where we were 6 months to a year ago. So I think having the opportunity to talk to, as it looks like you do with intake, prior to even the prospectus, is I feel like that understanding what types of characteristics, culture, meeting with different board members and ELT and maybe some community members would be helpful, because I do think that that will help narrow the focus of the type of candidate in terms of engagement, personality, and maybe historical let's say, activities that these people have had. I think that will help drive the right candidate forward. But I think it will look very different than what it did when you did the search 10 years ago, and even what you might have perceived 2 years ago. So I just encourage you guys to make that as a priority, because I think we're excited about what this will look forward, will look like in going forward, and then you know, like you said, the stakeholders, I think having some conversation with them will be important. So
let me check in briefly with the committee. We were scheduled this meeting for an hour. I think this is an excellent discussion, but I want to make sure from the committee members and also from our guests from AMN that understanding people may have other commitments. I am fine to continue going, but if people will let me know if they have places they have to be, let me know so that we can figure that into our time. I promise we will not go into a filibuster of 4 hours, but I would say if people are available for another 20 minutes or so, I think we can, if that fits everyone's schedule, just check in. Okay, well, we will shoot to do this by 1:45. Dr. Martin?
Are we going to see a cost proposal?
We will, yeah. So we approached this meeting today as informative, right? We wanted to provide as much as we could. And we could provide, probably back to David, what the fee schedule looks like. There shouldn't be any surprises, and just know that, you know, we want to make sure it's a good partnership in working with you, and we certainly take that in consideration as we discuss those fees.
Yeah, thank you, Bing. The cost information obviously is important for us to consider and look at, and if you want to send to Janet Lester, she can provide it to me and then distribute to the members of the committee. I think we will get to our next meeting date in a minute, but that will certainly be important information.
We could follow up probably maybe before the end of the day. We can get that information to you.
Yeah, we can provide pricing as per schedule by end of business. And as you know, we do have a contract with you. I would also offer, you haven't asked yet, but if there is a reference or references you would like to talk in the work that we've done and or the work that Mick has done, that would be something we would do upon request.
I would. You were reading my mind. Yeah, a cost proposal. And then you do have a list of successful placements for CEOs, but if you could provide us 2 or 3 references with as similarly situated an entity as you can think of that we can contact to talk about what it's like to go through a search process like this with you, public hospital, safety net hospital, partnership with academic medical center, whatever criteria you think are the most common, it would be helpful to talk to a board member or somebody at another institution.
I noticed your list of different relevant and successful placements. My question would be specific to the time frame that this encompasses. Is this like since inception, or all these placements within the last 5 years? What kind of volume are you guys doing?
This is not since inception. I believe, I'll do quick math. I think we did 250 placements last year as an executive recruitment firm. I would suspect about 20% of those were CEOs. We can do the math and give you the actual answer. I believe this is probably the last 5 years, but we can give you an actual answer on that. This would be recent history, not since inception.
I have a couple of comments, maybe questions, if you wanted to comment on them. I appreciate Dr. Nettles raising the specificity that we are a safety net hospital, and we also are affiliated with an academic medical center. I would also add to that we are the index hospital for a historically black college. That's an important part of our identity. We are situated in a neighborhood with other HBCUs. We are situated, or have been for the last 30 years, in a neighborhood that has been, subject to public policy and others that have had detrimental effects on the community where we are physically located. Practices like redlining, disproportionate investment by public entities, having an interstate, the powers that be, deciding to dissect this community with an enormous interstate. All of which happened well before any of us were here, but have effects that have lingered for decades. All of that is an important part of the story of the hospital. I say that because you mentioned diversity. I think, that is a term that is a lot of people talk about now. I don't know if it's diversity. I'm raising these things as issues of historical fact and things that are important parts of who we are as a hospital. So I say that as commentary and invite if you have any response or questions or your experience with organizations that are situated in that way that we are in particular, be interested in your thoughts on that.
Yeah, we want to make sure we're understanding you, and a lot of this comes from intake of what that means to you. Right, and incorporate that in and try to look through that lens from what we've learned from you as an organization. We just, Hisham and I just did the CEO search for Central Health in Austin, Texas. And that's a hospital district in Texas. Oddly, they're a hospital district that doesn't have a hospital. So they partner with the FQHC in town and then also one of the hospitals there. And their patient population is literally divided by a highway. If you're on one side of the highway versus the other side of the highway of downtown. So very similar kind of demographics and dynamics. I would relate to that. And the population that they served was very unique, but we had to learn from them what that was. And the delivery, we incorporated that into kind of the lens of how we went to market and recruited. So we'd want to do the same thing here for you. But a strong understanding of that, of community, what that means, the community that you serve and represent, all those things are factors that go into this. And we want to make sure that the person that assumes this seat as your next CEO appreciates, understands, and respects that. Those are all factors.
I just wanted to add that I really appreciated your comments about how quickly things have changed in even 2 years, even since the last hire. And also this conversation about the social determinants of health and how that impacts chronic conditions, how that impacts mortality and morbidity, and the variation, and how that looks differently depending on the population. In terms of hiring, and River and I are the client-facing, but we hear a lot about fit. Another way of saying it is culture, and you're going to want the total package from the wish list that we help you build, and sensitivity to these issues is really critical. So I also agree the term diversity gets thrown around and means different things to different individuals. So it's important for us to understand what it means to you, to your team, healthcare team, to your patient population, and to the larger community. So, and I also just want to say, the term vendor versus partner, because we're relationship people over time. We follow our leaders from organization to organization. We've been together for 7 years. So in an environment where stickiness is difficult and transition is more common than not, our goal is to bring as much stability as we can to the process, and in the end, land with the right leader. But all those social issues impact our lives and our health. So it's important.
One other consideration that I suggest to you, and again, invite either comments or how this affects your search, you could walk into a situation in a CEO search with a well planned out transition process where the CEO is given notice well in advance. There's processes going on, sort of well heeled, where there are already existing opportunities for stakeholders and important partners with a hospital like ours that are, well integrated. I think it is accurate to say that we are not in that position. We find ourselves conducting a search on the heels of a fairly sort of disruptive process to get to where we are right now. I think it's also fair to say that the hospital as it stands right now doesn't have great communication with a lot of community stakeholders and partners. I don't want to overstate that, but I think that there's work to be done on that respect. So it's sort of a different, I wonder whether, that state of affairs causes a different type of search than if there were already a mature, sort of healthy transition that this is a part of. Just interested in your thoughts on us as a committee entering into a process where that is the state of affairs.
And I think you also need to have someone who has a more entrepreneurial mindset. So instead of status quo. So I think, you mentioned, I think, someone coming in who has, kind of fire in their belly and passion. But also, the opposite could be someone who is a more seasoned individual. I think someone needs to come in with more of a transformative mindset, a true entrepreneur as to what this can be. I think done the right way, you'll have tremendous support, being that this is the healthcare mecca of arguably the entire world. And I think the community personally, and at least the people I've been talking to, they've been waiting on this. And you're going to have a board who stands behind this individual. You're going to have a community who stands behind this individual. And so I'm really, looking forward to what that looks like. But again, I think that needs to be someone who is not status quo, who isn't interested in coming here and, getting a check for the next 5 years. That would be terribly, I think, a terrible decision, for this hospital. So I want to make sure that from my perspective, I want the energy and the engagement, someone who can partner well with our city, partner well with us as board members, and look at the possibilities, be reasonable and thoughtful and fiscally responsible with every taxpayer's dollar. But I really do look forward to, the process and the people.
I think for me, the bottom line is that your work in creating this prospectus, meeting with the stakeholders, is going to be very, very important. And we can't meet with you as a board, but we would certainly like to, as board members individually, offer our input to your search and your prospectus.
That's an easy way to do it too, is to meet individually to get that input right. David, I wanted to address, when you look at kind of state of affairs, taking all these things into consideration, I look at our role and obligation when we bring you a slate of candidates. They shouldn't all look the same. They shouldn't all have the same type of background skills, right? And this is where I go to diversity in the panel, not diverse candidates, diversity in the panel. If it's 10 candidates, 2 up-and-comers that Hisham was talking about, excitement, energy, risk. You've got other, maybe 2 that are seasoned, low risk, can do it, worry about complacency. should have 6 down the middle, right, of different varying backgrounds, experiences that they can bring to the table, but giving you a choice. So if we've done our work right, and you've got 3 finalists coming in, they should look different, they should have different skills, different strengths, but give you a choice of who's best to tackle the challenges that we're facing right now for the foreseeable future. That's what I think, that's how we tackle that, right, is we're not trying through our own lens saying, this is what we think we heard and you need. It's, we heard what you need. Here's a portfolio of candidates that maybe can tackle it in different ways and give you a choice in deciding who's best to do that.
Yeah, the only thing I would add, and you said that, right? Like, you're not in a position where we've had time to plan. We know what succession planning looks like. But to both of your points, right, Mick and team are going to bring you the best slate of candidates, but it's probably not the candidate who wants status quo and calm who's going to come into this environment, right? Like, right, part of that innovation drive, you say healthcare mecca, you're exactly right. I think Dr. Martin and I were talking earlier, Boston might want part of that too. But it really is, that type of an environment. And I think hearing early on, it sounds like Veronica's doing well, right? So one of the consistent factors, we do interim leadership, but for you to be in a position where you feel confident in the individual that is your interim today, that gives us the ability to make sure that we get it right and it's not rushed, right? You heard Mick say that he wants to plan with you, but at the end of the day, being able to plan and make the right decisions versus making decisions because you have to, it changes your ability to get the right person here.
I'd also like to add that even though this hospital is the safety net hospital and the other terms that we have, for me, this is the people's hospital, and we know that Nashville is quite rich in so many resources, particularly in healthcare, whatever. But there's no reason why this hospital can't be leading edge, cutting edge. It should be a place where all learners will have an opportunity, even where we're physically located, to have opportunity to learn any type of condition, any type of situation that that patients would need. Also, this should be the place for continuity of care, and where everyone should be able to come here. I mean, and feel good about coming here, regardless of how close you live or if it's a safety net hospital. I like to see it as the people's hospital, and also someone who has vision for new things, being able to listen what's going on, connect with other, nationally, globally, what have you, but also encouraging the staff to continue their learning and to progress. That's going to keep everything very fresh and new and on top, where people enjoy coming to work.
If there's one thing about healthcare, constantly changing, right? So I really appreciate that learning aspect of it. I've been doing this for over 20 years, and I learn something new every time I do a search, right? And you incorporate that into what you do. And I always look for those opportunities to do that. But I like defining the organization that way, as a place to learn and advance and grow.
Thank you, Dr. Nettles. Are there any final questions or comments or anything from our friends at AMN that you want to say before we move to our final agenda item? If not, I again so appreciate the conversation. I appreciate you assembling your team quickly. This has been a great start to our process. We could not have hoped for a more productive first meeting. It's hard to imagine this is our first meeting. It feels like we are well into it, and that is largely due to the information that you've given us and sort of the platform. I will say to the committee members, sort of where we are in the process. We'll get references from AMN. We'll get a cost proposal. We can look at that between now and our next meeting. We will face a decision at our next meeting about whether we go with, I think the initial decision is, do we go with one of the 2 partners that are already teed up for us through procurement and contracting, either with Metro or the hospital. We have the option, if we want to consider other search firms to go through our own procurement process. That's probably at least a 3-month process, so the committee is aware that takes time, but we will take the time that is necessary. So I anticipate at our next meeting, we will, to keep this moving, make that decision. And we should be prepared to make that decision. We'll have the information we need to. And at that point, we can move forward with whatever the next step is. But I invite anyone on the committee. This is not a motion or a formal decision we have to make, but others' input. Dr. Nettles, Ms. Smith, any input on that? Okay. All right, so then that takes us to the very practical task of when we can meet. Dr. Nzarue, who is the fifth member of our committee, was not able to make it today. So he's not here, and Dr. Miller has just left. But my suggestion is to keep this on track and to make sure that we're moving expeditiously is that we plan to meet at a regular time every other week. I know it's a big commitment. All of us have commitments to the hospital board and to our lives outside of the hospital. I believe if we had a monthly meeting, we would move too slowly, and for us to do the work that we need to do. Now, it may be that we get to a point in the process where the job description is out in the market, and we don't need to meet every 2 weeks. But sounds like this is the cadence that AMN uses, and that's what I was going to suggest. Mick, you're going to have a comment?
Yeah, so on the onset of the search, when we do intake, we're likely not going to be meeting biweekly until we've established and have the prospectus, and then we start that biweekly cadence. So there might be a 3-4 week productive gap before we start meeting as a committee. But once we get into process, that 2 weeks is a good time period.
And for us, before we even get to, a search firm, we're going to have this, we're going to need to do that. So the question, I guess, for us is this a good time generally if we were to start scheduling by meetings every other week, or there is another time that's more convenient for us that we can will be better for our schedules?
I'm fine. I'm just out next Friday. Sorry.
Okay. How about 2 weeks from Friday?
You mean for the 25th?
Yes.
Is that what you're asking?
Yes.
Yeah, I'm
You're out.
I have a work event.
Okay.
Could we move it to midweek, like maybe a Wednesday or something like
I
that?
won't be back in town till the 27th.
Okay,
The next 2 weeks I'm out, basically.
okay.
But after the week of the 28th, I can do.
Could we do April 30th? That would be a Wednesday in the mid,
I'm fine with that.
and we would only be off by a few days.
Yeah, what I'd like to do is, I think it's going to start to get tedious if we were looking at our calendars. So I'm okay doing that. I mean, definitely on the 30th. Let's see if that. Dr. Nettles, what about the 30th for you?
Just depends on at the time. So
Okay. Ms. Smith, what time would this time, 11 o'clock,
Be fine.
with the promise of hospital food?
I think that
I really like the chicken. It's really good.
I mean, I don't know if you all ate it. That was delicious. It was.
I really should have got 2 pieces.
Oh, I had 2 pieces.
Did you?
Yeah.
Smarter man than mine.
there is a to-go tray over there.
10 o'clock is fine for me
All right.
on the
11
30th.
a.m.?
o'clock, I'm sorry.
That's okay.
11
All right.
o'clock on the
So
30th.
we need a quorum of 3. We at least have a quorum. I guess we'll check with Dr. Miller. If that time, think about whether that time you can either already have or can block out on your calendar for, say, the next 6 months, knowing that we may not need it every time, but it would be great to have something that we all can usually make, and obviously there will be exceptions. But our next meeting then will be April 30th at 11, and at that meeting a prime item on the agenda will be consideration of engaging a search firm.
And the recommendation is to do every other Wednesday at 11. Is that
That's-
accurate?
If people can do that, I would ask Ms. Lester to put that on all of our calendars, and let's see whether the committee, that's generally okay for the committee.
I'm sending it to the calendars, but I will also poll the 2 absent members to make sure that it works for them as well and get back with you.
That would be excellent if you could do that. And
Absolutely.
Right. Thank you very much.
Sure.
Okay. So, yeah, item 6, next meeting date to be decided. We just decided. I think, I would think to be fair to people, 90 minutes we will need because we went a little past that. I think an hour. The business that we have to conduct, especially now, is going to be hard to squeeze into an hour. Okay. All right. Is there a motion to adjourn?
So moved.
All right. We are adjourned. Thank you all very much.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.